Good morning, Mr. Andrews. I've heard some exciting news. The doctor says that you get to go home today. But before you're able to go, I have some things that I'd like to talk with you about. You came to the hospital initially with difficulty breathing and wheezing. During your stay here, based on the diagnostic test and your history, the doctors determined that you have asthma. I would like to talk to you about what this means and the doctor's plan for treating your condition. Asthma is a chronic inflammation of the bronchial airways. This inflammation causes the bronchioles in your lungs to be hyperresponsive, your airways to constrict, and airflow obstruction that is reversible. This is a chronic disease that's accompanied by acute exacerbations or flare-ups. There are many risk factors for developing asthma. Your history states that you had respiratory issues and allergies as early as childhood. That is one of the risk factors. Also, your family history of asthma puts you at even greater risk. These are risk factors that you can't really control. However, there are risk factors that you have control over. Smoking is a big risk factor for asthma. You've told me that you currently smoke over a pack of cigarettes per day. Smoking will put you at risk for greater incidence of asthma and flare-ups. One thing the doctor has suggested is that I give you information about smoking cessation. I'm going to leave information with you that you can read on your own. Also, I'd be happy to talk to you about different resources and programs geared at helping you quit smoking. Would you like to talk about those programs? Okay, I understand that you aren't ready to discuss this right now, but that you might be interested in information at a later date. In the meantime, we need to discuss other ways that we can help you manage your condition. Your doctor's prescribed a medicine that is a bronchodilator. That means that when the bronchioles are trying to constrict or tighten, this medicine will help them stay open by relaxing the bronchial smooth muscles. Your doctor's prescribed you a medicine called Combivent. This drug is a combination of ipratropium and albuterol, both of which will help with the relaxing of your bronchioles. This medication is in a class of drugs called anticholinergics. They work by blocking the action of acetylcholine, which in turn prevents the bronchoconstriction and keeps your airways open. This medicine will come as an inhaler that you will do 2 puffs 4 times a day. This will help maintain your airways and help with the shortness of air and wheezing that you're experiencing. There are some potential side effects of this medicine that you need to be aware of. Blurry, dry eyes, feeling flushed or warm, dry throat, mouth, and some constipation. It can also make you feel a little bit confused. All of these are potential side effects, but you should let your doctor know if you're having these effects or if the effects seem to worsen over time. Do you have any questions about this medicine? All right, you'll be following up with your doctor in approximately 2 weeks. At this time, you'll discuss how this medicine is working for you. However, if you notice any serious side effects before that time, be sure to contact your doctor's office so that they can advise you on how to proceed. Are there any other questions that you have before we get you ready to get out of here? Perfect. I think you're all set to go.